Hey everyone, welcome to another NDEB Updates. Dr. Hafez from Scholars Dental. In this video, I'm going to talk about some highlights from the NDECC webinar that happened in March, a few weeks ago. And I made some notes from the video that the NDEB has posted, and I'm going to share those with you. Let's go through this video, and the first point is at 1 minute and 10 seconds, that image here, showing that the skills component is going to be in 1 day. It's going to be 7 projects and 1 full day, and the situational judgment component is going to be 10 stations in half a day. So situational judgment is going to be 10 stations in half a day. So you have 7 requirements, 7 projects for skills in 1 day, and 10 stations in half a day. So the entire exam for each student for you is going to be 1.5 days, less than before. So you could kind of say, okay, is that an improvement? Before we had to do 2 full days, right? Now it's 1.5. And all the clinical stuff is going to be on 1 day. And if you go to now 1 minute and 30, and you can see here they're showing again the you have 2 options. You could choose to do the skills first, then the situational judgment the next day, or you could do the opposite where you do the half day first, the situational judgment first, then the skills on the second day. So whether you want to do the half first, then the full day second, or the full day first or the half day second, it's up to you. So there's those options, right? So that's for minute 30. And duration of the exam has not precisely been determined. So they don't know exactly now how long they're going to allow. Is it going to be from 9 to 4, 9 to 5? They don't know. They're planning a rehearsal to determine an exact time. There's going to be a mandatory lunch. And the situational judgment are going to test things not in the AFK or ACJ. So far, what we know, it's going to be, let's say, 2 days, right? 2 days. You have one like this. Let's just put it like that, 2 days. And on day 1, there's going to be 2 things happening. 10 people are going to be doing the skills, right? 10 people are doing skills, and 10 people are doing situational judgment. These 10 people doing situational judgment are going to spend half a day, and the people doing skills are going to spend a full day. Then on day 2, they're going to reverse. So the 10 people doing the situational judgment, they're going to be doing skills, and the 10 people doing the skills are going to be doing the situational judgment. So in this case, you could say in 2 days, right? In 2 days, we're going to have 20 people doing the exam. 20 students in 2 days. All right, let's go to the next section, minute 4. And here we just have them showing us the requirements now in the skills. And the requirements, I'm going to make this a little bit bigger here. You could see amalgam class 2, amalgam restoration, composite class 2 restoration, composite class 4, crown preparation. Now look what it says under the crown preparation. The crown preparation plus the temporary you're going to do on it, that's 2 projects. And the crown prep will vary based on the type of material used to make the crown. So they might tell you a full ceramic crown. They might tell you a PFM crown. So based on that, you have to know the knowledge and adjust the preparation. Then endodontic access. So they have confirmed here the skills will be done all in 1 day. Rubber dam has been removed because it's not a unique thing to dentists. Assistants could do it too. Class 3 has been removed. It's testing minimal invasive dentistry, and now they're doing that in a class 2 prep on a stock tooth, because you're doing now the class 2 amalgam preparation on a plastic tooth. You're no longer doing it on a Kilgore caries tooth. Also, they are not going to be testing record keeping. So charting has been removed from the skills test, but may be asked about in the situational judgment test. So I'm going to make this smaller again. So back to the skills projects. Okay, there's going to be 7 So no record keeping on that day. But it could be moved to situational judgment. Okay. Now let's go to the criteria, to 5 and 50. Okay. So here they're showing you the new table for the criteria, and they have eliminated the letters A plus, D, and E. And now they're going to use this system, which is competent, minimally competent, and not competent. And then you have at the end, there's critical errors. So if you do any of the critical errors or not competent, you fail that project. Okay, so you have to be in the first two, the passing area. Okay, the competent and the minimally competent. So minimally competent, you'll pass. If you get in a project any error from the non-competent, you fail that project. Okay, and from what I understood, you can't even fail a project. Okay, any project failed will cause to fail the exam. I'm going to check that again to reconfirm it, but now each course will probably, if you're taking a course, they'll teach you these criteria. But from what I understood, they probably eliminated the D and shifted most of the things, like A. You could say the competent and minimally competent are probably like an A and A plus. But I can't confirm that right now. That may need a different video to look into. Just know that the criteria now, you have to be in the minimally competent at least to pass. No failing allowed, not even one column for the project, right? You can't get non-competent. And I guess that's similar because before, if you got an E in a column, you would fail the project as well, right? And then the overall picture was you were allowed to fail one project from the 10 projects, right? In the ACS at least. So that, let's look here. Remove the letter system and now use competent, minimally competent, and non-competent. The competent means the best performance. That's what you should aim for. Minimally competent describes the lowest range that you could pass with. Any error in the non-competent or critical error will result in fail. Now let's go to 8 and 10 minutes. And over here, we have they're talking about the situational judgment. That they're going to test all the 5 components, and they have it here in this slide. These are the 5 components. I mean, we've heard it before in their announcements. You have to demonstrate your skills in managing situations related to the care of your patients, professionalism, communication and teamwork, the management of dental practice, and the management of information, and the promotion of health. And then we go like, well, what does that mean? We want to know more details. So luckily, they have examples. Now they gave us some examples about situational judgment. I'm going to go to the first example at 10 minutes and 40 right here. There you go. So first, there's a general kind of example. So for each one of the above, there will be 2 situations. Okay, so for each one of the 5 categories that we just talked about, as we mentioned, these categories, right? So you have 5 categories in situational judgment. Each one of the categories is going to have 2 stations, right? So that's why you have 10 stations. So 5 categories, each one has 2 questions or 2 stations. Okay, all stations will have the same duration. So you're going to have the same time on each station. Each station will have detailed instructions, and your task is to do this following. You're going to read a scenario, then write your answers down. Maybe read a scenario and talk to someone. Maybe simulated instruct a patient or a person about the scenario. Maybe the person doing the exam is going to listen to you or pretend to be the patient. You might be reviewing an article and answer some questions based on it. You might look at a video and answer some questions. So it's good to look at now the examples. So let's go to time 11:30 right here. So here's the first example they showed. And this is showing the room that is for informed consent. So now we know there's going to be a question about informed consent, right? Possibly. And that's how the room looks like. So you can see here, this is a station. You're going to be sitting across from the examiner. There's a laptop that may show a video. There's going to be probably a recording of you, a video recording, maybe also like an audio. Everything's recorded. And you might watch a video. They might ask you a question. They might pretend to do something and you have to answer. This is one station. You're going to have 10 of these, and 2 for each category in the ones we presented or we just talked about. So that's how it's going to work. Okay. So that's for example, how to obtain informed consent. You'll be sitting on the table across from us. Okay. Example, you would have to obtain informed consent from a patient for a specific dental procedure that would be described in the scenario. So they might give you, okay, you're going to do an extraction on this patient. Here's their case. How would you now give informed consent or obtain informed consent from that patient for the extraction? That's an example, right? So it might be a little bit more tricky. You know, some people may have some more anxiety or stress trying to perform this, and you might be even good at it while you're doing it in front of your patient, but when you're doing it in front of an examiner, you might have trouble with it. So that's why it's important probably to practice this. But, you know, try to combat, if you're doing this, just try to act normal. Do what you would do professionally with a patient and naturally. Okay. But anyway, I'm not here to give any really advice on the exam yet, because we don't know exactly what the questions are, how it's going to be until we see the first one happening. I just want to shed some light on the highlights of this, of what information we got from the webinar. So another thing they noted is many examinees don't have English as a first language, and they said this is not an English test, but you should be able to discuss a procedure and obtain informed consent of the procedure from your patient. I think that's fair. You know, they're not testing your English, but they want to make sure you could actually do what you need to do as a dentist, right? So now the grading for informed consent will be the same way as the skills, how you could see competent, minimally competent and non-competent. And you could probably get, you know, it just says here minor errors, manifestation is good. It doesn't really have any details, it seems like, but they're saying each category, like for informed consent, there may be a specific way of how you're supposed to answer. It's going to be like clear where you fall. Or do you fall in the competent, minimally, or non-competent? So it's using that same style for grading. Now we have another photo at 1330. Let's go to that one and show you here. They're just showing that, okay, in this one, the example is writing a progress note for a dental visit on a laptop. So this is pretty much similar to doing record keeping that we had in ACS. So basically there's going to be a record keeping question, right? So they're going to tell you, okay, you did this procedure. Now write your record keeping in a note on your laptop. Kind of simulates what we most do now in dental clinics. All right. So, and must demonstrate you could write a note for a specific dental procedure, show you are able to chart properly. It is not a test about English again. It's about that you could write an acceptable note in your chart. And it's going to be the same style, competent, minimally competent, and not competent. So far you could say for SAG, we said we have 10 stations, right? And so far we could say we have informed consent. I feel like if they're mentioning it, it's most likely they're working on it as a question. And we have record keeping. Now the difference here is in the ACS, you knew the record keeping for which projects would come because it's going to be for the 12 projects that you're working on. So you might be doing the ones for, again, the day the record keeping, you'll be doing the record keeping for the ACS projects on that day. But now it's more open, so they could bring you any procedure really. And I think here the best thing to do is just really, I don't think you should memorize these things. Just really imagine you're in an office and what would you do and what would you write, and then just do that. And I think that'll be acceptable if you could, be calm and try to be natural in responding that way. So now we know those two are the questions we have. Third example, an ethical dilemma. That's at minute 15. Let's go there. So they're showing here, another room, and someone is testing you and asking you a question. So there's going to be an ethical dilemma question. So it's kind of getting like into interview-like questions, right? So the ethical dilemma, you have to demonstrate that you are able to respond to an ethical dilemma with a patient or staff in your dental office. Graded style, same, but same thing. So it's going to be competent, minimally competent, and non-competent. Just each scenario here will have, its own grading system and columns. So ethical dilemma as well. But that's really broad, right? Like they could bring anything really. The next would be minute 16. And we're going to talk about the evaluation and grading.